Good afternoon. I've been asked to give you an update on what the police department is doing in light of the COVID-19 pandemic that we're currently experiencing. First thing I want to tell you is that the police department is not per se stopping cars to check where people are going or when they're going. That has not been an issue so far. It's not something we're actively doing. What we are doing is we've increased patrols throughout the village because frankly we've had an influx of people coming into the village from out of the area. We are encouraging people that come back, summertime residents that come back, to quarantine themselves voluntarily for 14 days inside their homes. We are also doing well-being checks to get us to do a well-being check. If you have a loved one that staying here by themselves, we ask you to call Central Dispatch. The number at Central Dispatch is area code 231-869-5858. That's the non-emergency number, so you don't have to feel like you're calling 911, but that's a non-emergency number, and we have officers on duty that will go out and do those checks for you. Administratively, we are meeting with members of the community leaders, 3 times a week to discuss kind of coordination of food pantries, those kind of services throughout the village. And the police department is assisting those community organizations upon their request. We've helped out at the community dinner at the Methodist Church, and we've also talked with the Baptist Church about what's going on there. Couple things that I'd like you to think about if you're considering coming back to Pentwater. One thing you need to know is that in the Mason and Oceana County areas, our medical facilities, while we do have hospitals, they are not in a position to offer a lot of services that you might get at a larger urban area. Frankly, if we do get impacted by a surge later this month, those facilities are going to be inundated rather quickly. The other thing I think you should think about is your proximity to your own healthcare provider. If you do come to Pentwater, bear in mind Spectrum's Pentwater Family Practice is no longer in operation. That office was combined with the Hart Family Practice, and the Hart facility is also closed. So currently we do not have a doctor's office in Pentwater, so that could present an issue for you. Another point to think about is your insurance. Remember, if you do come to Pentwater from out of state, you will most likely be out of network. So you need to make sure that you understand the implications of that on your specific insurance policy and what that means for you as far as costs and that kind of thing. If you do come, I would encourage you to make sure that you bring a supply of medication, your prescription medication, so that you have that on hand, because I don't know how that's going to play out as we move forward here. My final thought to you is, we're working hard to facilitate a lot of things here in Pentwater. Not only the projects you've heard discussed by our village manager and village president, but we are meeting daily, sometimes twice a day, just to keep current of really an evolving situations occurring across the country. Even though you see the numbers in Oceana County, the most current thing I heard yesterday was reported was 3 incidents and none in Mason County. That does not mean that people here are not positive for COVID-19. There may be many people here that are positive that have not been tested for any number of reasons. So it's really a misnomer to think that you're going to come here and the threat is any less likely here. While we do have less dense a population, doesn't mean that population is any less infected by this surge. In closing, I just want to urge you to be safe at home, practice good techniques as they've been described by the CDC. Wash your hands, cover your mouth when you're sneezing, and stay inside. Really, the only thing we're going to do to stop the spread of this pandemic is to practice those safety guidelines. And I'd encourage you to do that. And that's really all I have. I hope you're safe wherever you are.